As we continue on America's finest operation, this would be the last sane talk show in America, as you could tell by the helium guy a minute ago. I got to get this Cheetos dust off my fingers. You should see what I'm doing with the
snack
equipment.
was delish.
Yeah,
Thank
crazy.
you.
Dr. Kevin Most joins us now. We have several important things to discuss. Good morning, Doctor.
Oh, wait, did I just hear Cheetos for breakfast today?
Yep.
These are the number one snacks in America by state. In Illinois was Cheetos.
That's a whole food, isn't it?
Hey, you guys are health nuts. Yeah, I didn't realize that.
Yeah, that's us. That's us. You know, we just ran out of granola like 5 seconds ago. It's crazy. All right, so I have a question for you. The show started off a little rough today because Jane butt shamed me. And she suggested that I need butt implants.
Because he likes to shake his booty.
So are butt implants a safe option, and could you do it in the garage at your house?
We don't do them in the garage. We bring that inside the garage a little too dusty. But, they are safe. And it's kind of amazing what's going on in the quote-unquote plastic surgery world as far as implants, whether it's, implants in the cheeks and your face or the other cheeks. And even some of the techniques now that dermatologists are using, with cool sculpting to kind of get rid of some more fat. So, the United States is very obviously focused on how they look, and you could just tell that. Look at what's going on with Ozempic now, as far as how many people are taking that for weight loss, and looking what's going on between dermatology about making our skin look younger and healthier, as well as what's going on with plastic surgery to change our faces. And it's an amazing business.
It really is. I have a question, though. The cool sculpt, I've done it before. There was I did it years ago when they were first new. Is that, I can't imagine that's healthy to kind of coagulate all of that fat and then burn it off.
Yeah, as far as the health of it, people can look at it two ways and say, is it healthy the way we're doing it? But also, the area that they're taking that away from is probably the biggest area of our concern for heart disease. When we look at fat, we can look at fat in our legs and go, okay, that's not as bad as fat around our waist. So certainly removing fat from the right portions of our body can definitely have a health impact.
All right, so what about
whether you do it the easy way or whether you do it the diet exercise core building way is two totally different subjects.
Yeah, so what about 10,000 crunches and a bunch of glute work?
Oh, yeah, definitely, 100% more. But, we live in the United States. It's either a pill or how quickly can I get it done. So we're really not focusing enough on just our health and our core strength, as well as our balance as we age, is probably one of the most important things that we can work on.
Well, speaking of balance, I just did 2 squats, so I'm upping the number. I'm hoping to get it up to 3.
Did you drop 2 Cheetos or?
I think it's all about functionality and aging. You can do your squats.
Yep.
When you drop your Cheetos, just make sure you're doing your squats.
Mm-hmm. Yeah, what you said.
That's right.
Daylight savings time is back on the breath of those that would like to change it and have a standard time all year long. Your thoughts?
Yeah, we changed this Sunday, so just make sure everybody's aware of it. And there have been a lot of studies that have been done to look at the health impact of it. And really, it's those first couple of days. The number of fatal accidents on that first Monday is up 6%. And then we look at also the strain on our heart and the impact of the change in our blood pressure and some of the hormones. And we see an increase of heart attacks that occur really in that first week, so next week. So, I'm a big fan. I like that it's later, but I don't like the shock that we shock our system. As we change through spring into winter into spring, we gain a couple of minutes of daylight every day. Well, the big shock of having 60 minutes of it happen at once is not really great for our health, and we really need to make sure that we're aware of it and be really careful next week. And you might feel a little depressed at times because you're waking up and you're not getting that sunlight in the morning as much, and that's probably the other big thing.
Listen, I'd like a standard time year-round. What's the downside again, that maybe we hurt ourselves? Well, you know what? Darwin's Law.
Survival of the fittest, yes.
Anybody a big fan of of not having a standardized time situation?
I mean,
changing the clock?
I like to change it up.
You do?
It's always exciting. It just throws you off a little bit.
I got to talk about your definition of excitement.
I mean, it's just such a pain. That's why it's just fun. It's just shake up in the middle of March. You're like, all right, let's try it.
Well, Doc, when we were kids, the old argument was the farmers needed the time change. There's not a single farmer who will agree with that anymore.
Correct. Yeah, you're right. I mean, it's still light the same number of hours. We've just changed the clock. The farmers are going to work at the time that it's important for them to work, whether it is 6 o'clock at night or 7 o'clock at night or 8 o'clock at night.
They got lights on a tractor.
Like we're making a convenience. Exactly.
Right.
Yeah.
Right.
I mean, we make a big deal out of like, oh, the sleep, the not sleep. But when you travel, if you go to the East Coast, your time changes. You go to the West Coast, your time changes. You go international.
Yeah,
you get through it.
You do that willingly.
Yeah.
Good point.
That's true. That's a great point. Miranda, that's a great segue into weed. Cannabis, cannabis use and heart disease. What do we know?
Well, it's interesting. Historically, when we looked at the study of cannabis, we really haven't had very good studies. Why? Because people were hesitant to step forward and say, I use it on a regular basis when it was not legal. Now that it's been legalized for recreational use, we're starting to find out more and more about it. And it's a little concerning. Studies coming out this week in JAMA, which looked at almost 500,000 people between the ages of 18 and 74, and saw that people who use cannabis on a daily basis have a 25% higher risk of heart attack and a 42% higher risk of stroke. So really, we're talking a really safe medication. This is a really safe drug. We now have to really temper it and be careful as we do more studies to notice the impact on our health, especially our cardiovascular health.
So, is it amount of consumption, the times you consume? What's the trigger here?
Well, daily, but how much daily?
Yeah. Oh, we lose Doc?
Uh-oh.
Yeah, maybe.
Oh, maybe he had to fire up his bong.
Spark it up.
Yeah, so it says daily users, but you're right. How much use? Is that because you compare it to like alcoholic drinks?
Well, but I also mean the time of day as in,
If you're going to sleep.
If you're going to sleep,
Right,
or should it be something you don't do before you go out on a 60-mile-an-hour highway?
Right.
You know?
Right.
Well.
And use. When are you
Or I
using
should
it?
say any highway.
But there's side effects to
60-mile-an-hour school zone.
drinking is legal and people drink all day, every day. So there's side effects to that as well.
Let's get back to Doc here. Consumption, how much? What's the trigger?
Well, it's daily use. So individuals who smoke marijuana or take marijuana or take THC daily. So it's not like we can't quantify it in packs as we do in cigarettes because it's so easy to say pack years, whereas marijuana is used more sporadically. But the question they asked was, do you use marijuana on a daily basis? And those that said yes, unfortunately, we saw this large increase.
And what's the advice? Because it's not something you're going to necessarily talk over with your doc, or is it?
Well, it should be now. If you live in a state, where it is legal, which is 24 states right now, and many more are looking at it currently, this should be a conversation you're having with your doctor. Just like you do with alcohol, just like you do with cigarettes, indications of how much do you use and how often can you use it. I think the biggest thing now is we're going to start to see more and more controlled studies, more studies that are going to be more accurate because people are going to be willing to say, yeah, I smoke marijuana, but it's legal. So at least we'll have that baseline. And then are we going to have to change the marijuana in a filter way? What are we going to have to do to make it safer based on some of these results?
Are gummies less impactful in a negative way because smoking is direct to your bloodstream, or?
Exactly. Yep. When we take, it's two interesting things, the way the THC gets in your bloodstream. When we take something in smoking, if we bring it into our lungs, obviously, people don't understand the amount of surface area in our lungs and how quickly that will get into our system. Same with the gummies. It doesn't get into our system as quick. Why? Because it's going into our stomach. There's not as big a surface area. It's also in a solid form. So absolutely, those who are smoking it, and we're still going to be looking at what's the impact on lung cancer is this going to have, because marijuana does not have all the chemicals that cigarettes do, but it certainly has some.
7:46. When we come back, there's new rules on COVID I think you're going to like. And let's talk about pesticides and Parkinson's. Former morning show on B96. No, I wasn't him. Oh, I'm still being told.
No.
Wrong. Back to Dr. Kevin Most. Turns out I need a microphone. I started talking into the phone.
Nobody knew that.
Yeah.
Oh, you were talking in the phone.
Yeah. Dr. Kevin Most, we continue. Good news from the COVID front. CDC now says what?
Yeah, CDC came out with three probably big things that everyone needs to know. One is they removed the 5-day isolation. So someone that tests positive for COVID now, we're saying, hey, if you're fever-free for 24 hours, you can come back. Instead of saying, hey, you need to be isolated for 5 days, when after really 2 days, you might feel completely fine. So that's good for individuals in the workforce, as well as in the schools, where we're keeping kids out of school for a 5-day isolation period where they may not need. So that was one big thing. And then two others is anybody who wants to order free COVID tests, you have to do that by this Friday. As of this Friday, the U.S. government will no longer be sending out free COVID tests. So do that. It ends on March 8th. And then the last is the recommendation of a booster for all those over the age of 65 this spring. So using the same vaccine we've been using since September, but recommending that individuals over the age of 65 get a booster. 18 to 64, forget about it. Just those over the age of 65.
Well, that is a big deal. And again, science is you know what you know when you know it, and you act accordingly. And that's why this change is being made now.
Are we to the point where we're treating COVID now like any other respiratory illness because of the history of it and because of built-up immunity, vaccines, so forth, so on?
That's it, Jane. You hit it right on the head there, is that we're starting to treat this just as a respiratory illness. This strain, that may change, but this strain we're starting to treat just as that. Natural immunity, almost everybody in the world has had COVID at least once, if not multiple times. Many people have been vaccinated. So we're starting to look at the immunity, and that 5-day isolation was to slow the spread. Well, if we have great immunity, then slowing the spread is really more important on when you're the most infectious. So that's it. But it's interesting, too, the strain that's going around right now, the JN1, COVID has kind of fallen off the media side, but in the medical side, we look at it quite a lot. And, this strain came out in September. It was only a couple percent. And really, even in November, it was still in single digits. But now it's over 80, 88, 85%, something like that. This has spread dramatically across the country, this new strain. Not causing severe illness, not causing hospitalizations or deaths, but certainly is going to be the one that is now acting more like an influenza.
And the super shot will be, if we can get that Slurpee, that cocktail of the flu shot and a COVID shot. Is that happening by next fall, or is that a long shot?
I think it's a long shot for next fall. I know there's 3 or 4 companies working on it right now, but it'll be interesting to see if they can pull it off. And again, I think what we're really more concerned about is the acceptance. If we put those together and someone says, wait, I don't want that COVID shot, are they now not going to get the flu shot? Because now the company has to make a decision. Are we all in for a combo shot, or are we going to go to the manufacturer 3 different shots now, an influenza shot, a COVID shot, and a combo shot? So the logistics of it will be very confusing that they're going to need to work out as well.
I thought one of the reasons of designing this new idea would be to put them together so people have less excuses to not get them because you're going to get them in one deal.
Absolutely. One shot, one deal, make it easy. People have to understand when they get influenza, they're getting vaccinated against 4 different viruses. So what would be the difference if we added a 5th? So certainly, unless you heard, anti-COVID or think COVID is a hoax, there would be no reason to not get that all in one combination to make sure that we have great coverage for everybody going into next year's respiratory season.
Reminder on the shingles shots, since we're talking vaccines.
I was just thinking about shingles shots.
Yeah, definitely. If anybody has not, the shingles shot is so important. You see a lot of ads on it now, and that's good. I mean, I'm not huge on advertising for pharmaceuticals, but this is one that I am. getting that shot and then getting the booster shot. You get a very good protection after that first shot, but that second shot gets you protection from shingles up over 95% of protection from it. And that is good. Talk about influenza where we're happy if we get 40, 50% protection. So it's a great vaccine. And individuals who have had shingles, I can tell you, they will be the biggest advocates to tell everybody, get it. It's the most painful illness around, and it is devastating to people.
Yeah, just make a note of when your second shot should happen. I was on the phone with Doc.
2 months later?
Is it 2 months or 3 months?
2 to 4 months. Yep.
Yeah, I was on the phone with Doc, and like his alarm went off on his watch or something. He goes, I got to get my other shingle shot today.
Yeah, but doesn't it make you feel lousy for the weekend? Let's say you get it on a Friday.
Yeah, it does, Jane. And I'll tell you, I would rather feel lousy for 2 days than have shingles for 1 day.
You're right.
Yeah, I got to do it.
You just got to plan it, though. You just have to plan when you're going to take that weekend. You know you're not going to feel great.
Only got a couple minutes here, but pesticides and Parkinson's, this is scary.
This is, it's scary and it's interesting. It's scary and good. So this is a study that was just released prior to this big national conference on neurology. And the author goes to a point of saying Parkinson's may be preventable, and we should live in a world where Parkinson's is increasingly rare, not common. And what they found, they looked at 13 states between the Great Plains and the Rocky Mountains, and they looked at 3 major chemicals that we use as pesticides and herbicides, lindane, smazine, and atrazine. All 3 of them are banned in Europe, by the way.
Wow.
So 2 of them are still used here. But they showed that those individuals that lived in a county with a high rate, high exposure, had a 36% higher chance of Parkinson's when they compared to counties who continued to use these herbicides, but at a lower rate.
What about the effect on the food supply? Because farmers, of course, rightfully are 100%. Concerned about being able to deliver crops.
Absolutely. That's going to be the biggest thing, and that's why these other chemicals that are banned in Europe are still being used here. The lobbyists for that are going to say, hey, wait a second, we can't afford to lose a crop to whether it's insects or whether it's whatever. We rely on these. And then it's going to be, okay, then the people that live in that area have to be well aware because it's in the air, it's in the water, and it's on their food. It's on our food too, but we, are not getting exposed to it.
I know we're out of time here, but has there been a study of the incidence of Parkinson's and farmers?
Oh.
Well, that's exactly what this is. This is saying the incidence of Parkinson's in these areas. If you're saying specifically the farmers who are laying it down,
right.
I don't know. That's a really good question. This one took it even bigger and saying the communities that live in this area where they're using high doses of this. So,
well, you understand my concern with putting trust in politicians to determine the food supply. Haven't they done enough? Dr. Kevin Mose, great as always. Thank you, my friend.
Thanks, Dr. Mose.
You got it, man. We'll talk to you guys soon.
Thanks.
All right.
There you go.